Hey everybody, it's Wednesday, time for Wisdom Wednesday. I was out last week, so back in the saddle and back in the office this week. I've had several patients recently come and talk about a lot of issues with joint pain, and I know that oftentimes when there's barometric pressure changes and changes in our climate, that sometimes our joints start to be a little more uncomfortable. But I also thought it would be interesting to help you understand the differences between what we call rheumatoid arthritis and osteoarthritis. Rheumatoid arthritis is an autoimmune disorder, and it is something that really, because it's autoimmune, has different ways of attacking the body in terms of utilizing antibodies. Now, osteoarthritis is a type of joint pain that really is from overuse or too much weight on a joint, or just aging in general. We see much more in the way of bone spurs and what we call osteophytes, these little bone spur things that occur within the joint. And rheumatoid arthritis really is affecting the bone itself more so than the cartilage. It's the cartilage in osteoarthritis that tends to be the problem generally. There can be quite a bit of crossover, but there's definitely a difference between the autoimmune disorder of rheumatoid arthritis and the overuse and pressure issues that occur with osteoarthritis as we age. And there's a difference in the time of life that we tend to see these. Generally, with rheumatoid arthritis, we see that it's diagnosed somewhere between 30 and 60 years of age, and osteoarthritis tends to be problematic for folks that are older. And we know that in the hands, the what we call the distal joints, these joints at the end of our fingers tend to be more related. When you see a lot of pressure there, it's osteoarthritis, whereas rheumatoid tends to be more the what we call proximal joints, or closer into the body, the proximal joints. Rheumatoid arthritis can also affect other organs, whereas osteoarthritis is really just a joint issue with the cartilage and aging. So there is a difference in not only what we call the pathophysiology, how it occurs, but then also how we treat it. We know that with rheumatoid arthritis, there are medications, things that affect the immune system, anti-immune medications, whether it's Humira, Enbrel, things like that. There are methotrexate is one that they've used with that. There's also types of treatment that lower the cytokines or the tissue necrosis factors that affect joint. When you hear about commercials on TV and the fact that it can lead to immune problems, when you're damping or suppressing the immune system, other things can come to light. So that's why you have to really be mindful when you're treating things like rheumatoid arthritis with anti-immunologics or biologics, etc. Steroids are used to help with inflammation. Obviously, with osteoarthritis, we use a lot of non-steroidal anti-inflammatories. Physical therapy can be helpful. Ice and heat can be helpful, but really strengthening the muscles around joints, either with physical therapy or just with working out, is probably one of the best things you can do, particularly with osteoarthritis as we age. So keeping good range of motion and being active and kind of working through some of that pain is really important as we age in order to maintain mobility. And maintaining mobility has to do with balance and range of motion with our joints. We know that with rheumatoid arthritis, it tends to be symmetrical on both sides of the body, whereas with osteoarthritis, it might just be one knee or one hip or one hand or one just joint within the hand that might be problematic and causing issues. We know that weight management is very important for trying to eliminate and reduce joint discomfort. So if you are overweight, working on weight reduction is very important, as well as having an anti-inflammatory nutritional program. We know that there are certain foods that are just more inflammatory. Sugar, for instance, is just much more inflammatory. You've heard me talk about that over and over and over, as well as with rheumatoid arthritis, many proteins that are hard to break down, particularly wheat and dairy are proteins as we age that get a lot more challenging to break down and can cause disruption in the gut and allow these things to leak in, and then we make antibodies, and these antibodies look like some of the tissues in our body. So that can be also important. And I tell folks, if you wake up one morning and you just are a lot more uncomfortable and more sore today than you were yesterday, looking at the previous 24 hours and what you have been eating can be very helpful in terms of trying to identify those foods that may be an issue for you. There may be some really healthy foods that are out there. Some people have issues with nightshade vegetables. Some people have issues with the top foods that are problematic: wheat, dairy, eggs, corn, soy, and peanuts. Those are the most common food sensitivities, and it's not that they cause anaphylactic shock or that you have an allergy. It's a sensitivity, and that your body just does not break it down well. So understanding that can be really important. And then, at some point, there are people who do have to have joint replacement when there's so much damage and just not able to get around. And that's generally with osteoarthritis because loss of cartilage in there. So I just encourage you to maintain a good, healthy weight, exercise regularly, the things that we talk about overall. Protect yourself from injury. If you are really active, wear protective gear if you need to. You might, again, work on the muscles on either side of the joints so that you strengthen, so that it keeps those joints stable and you have less pressure and pain that it's eroding that cartilage and causing more inflammation within the joint itself. And, if you have underlying chronic illnesses, be sure to address those as well, because they tend to increase cytokines and inflammatory products in the body that cause more damage. So hopefully this has been a little bit of a education for you in understanding the difference between a rheumatoid arthritis and osteoarthritis, which is what the vast majority of people as we age seem to develop. Hope that's helpful, and you all have a great week, and we'll talk again next week.